Greetings. This is Dr. Sudhir Srivastava. I'm founder, chairman, and CEO of SS Innovations. And we established SS Innovations in 2016 towards the later part of the year, and have been working on developing a surgical robotic system. From my background, I am a cardiac surgeon and got very interested in minimally invasive robotic cardiac surgery back in 2002, and really developed some of the world's first type of cases during the early years as the robotic system in cardiac surgery was relatively new, and pioneered many procedures that are being followed now by many surgeons around the world. And at a point in time, I accumulated the largest experience in robotic cardiac surgery, having performed over 1,400 or so robotic cardiothoracic cases. Since then, it has been a passion based on all the benefits I saw in patients who normally would have splitting of the sternum, certain complications that can be disastrous, and tremendous benefit in terms of the recovery and getting back to functional status much sooner than other approaches. So that kept me going to really find a solution, because the existing robotic system, although a wonderful technology, and I'm grateful that they led a path for us to start thinking differently to be able to do complex operations, but the machine remained quite expensive, and there was a very uneven and poor penetration in almost greater than 2/3 of the world, and particularly the developing economies or even the hospitals that were smaller and just could not afford the system. Even in many countries, the patients could not afford the cost of the procedures because of the use of very expensive instrumentation. And recognizing, I really felt that it is time that there must be an option. The company that initiated this enjoyed monopoly for almost over 20 years. And I felt that having had the experience of the robotic surgery and learned the intricacies from a surgeon's end user viewpoint as to what might be needed or what could be improved upon in relation to the existing technology. So I undertook that as a mission.
He is the undisputed pioneer in this sort of work. He has been doing this and we've been working together on minimally invasive approach to heart bypass surgery for approximately 8 years.
I choose this as a field as my passion, not for my career or something I need to get like a job. I choose that with the next generations where the technology can help really like near to the very near to the humanity.
Most exciting part about working in this project is that you get to know a lot about what's important from a medical perspective, from a surgical point of view, because that's something that most of us engineers don't get exposed to, and to satisfy what is needed medically to ensure that someone there's really lives at stake here, and that's something to that's a challenging thing, and that's a I'll say from technical standpoint that's a great thing to have, because that pushes you to work that much more harder and to come up with innovative solutions. That's really the best part about this job.
We went through many trials like animal trial, cadaver trials, but I've never imagined of human trial, and this feels very exciting and also a little bit of nervousness, because we are making it by our hands, so we never know what would be the outcome, but we always hope for the best. So it's very exciting, and it's a proud moment for me.
And with regards to our most recent clinical trial at the Rajiv Gandhi Cancer Institute in New Delhi, India, we are very pleased to report that 18 complex surgical procedures were performed utilizing the Mantra surgical robotic system. Now for us, this is a wonderful validation of just how far we've come as a company today. an incredible reminder of just how far we'll go tomorrow.
This system, especially this mantra system of yours, is very good, and it seems very affordable to the population of our country, and especially third world countries like India. And what I can say, that this is a very good system. It is safe to use. We didn't encounter any complication safety related to the patient. In immediate post-op, all the patients, they did very good without having any procedure related complication. They got discharged within 4 days, 3 days without having any complication. And they didn't even require blood transfusion in the post-op. So indirectly we can say it's very safe to use. And we did it, we completed the procedure within accepted time duration also. Regarding safety, it's very good system, and I hope that after having this system, the most of the population will be having this affordable system, and we will try to outreach this system, and we will try to include as much as possible this minimal invasive surgeries assisted with the robotic platform.
As far as mantra is concerned, I have used in now 14 cases, and we plan to go around 20 cases maybe by next week. And I found that this is a good machine. I could use this robot for not only benign surgery, those we do very few, but all the big surgery like radical cystectomy and nephrectomy and even partial nephrectomy. And I feel that as the company is pricing this robot in a really low down, which will help having this machine in all the centers who could not have robot technology because of the cost. That's the best thing with this machine, and I feel in future this will change the scene in robotic surgery, not only in India or Asia, but in all over the world.
I think it is a combination of things. One, that there was a global need to have a system that was felt in a very urgent way, and the benefits that were being missed out by so many people. So essentially, a group of us decided to take this on. And in any startup company, what I always say, it's not a job. It's a commitment, and it's a commitment to innovate. It's a commitment to meet the unmet needs by millions and millions of people around the world. And the bigger vision is really to change the direction of surgery, because there's no reason in today's environment, especially availability of the technology, the evolution of surgery, that patients should have large incisions and long recoveries. And so again, I want to take this opportunity to thank our team. So just grateful to the sacrifice and their dedication and commitment and their tireless efforts. Thank you.